us on. I'm Dr. Goggin. You can call me Sunny. I'm from Feel Good Functional Medicine, and I am so happy that I have Donna White. Donna White is the founder of the BHRT Training Academy, and she has written books. She has been in the hormone space for 30 years as and one of the leading thinkers in this area. So we're going to answer some burning questions. Welcome, Donna. Welcome. It's so great to have you.
Thank you, Sunny. I'm so happy to be here with you and your fabulous audience. And hopefully we can give value and help some people today.
Well, I don't know. I mean, when I think of my first flashes, my hot flashes, it was like lit by a match. And I also remember that my brain just went out the window. And so if you guys are struggling, feeling like, you're in the middle of menopause, or you're looking at menopause, or you're in menopause and having symptoms, it's not always hot flashes. Sometimes it's cognition, sometimes it's other things. We're going to answer some important questions for you. So thanks for joining us. Make sure to stick around because you want to know about hormones and cancer, right? Aren't you curious? You probably want to know how to help your doctor, or if you're a physician and you're like, I don't know what to do. People come to me and ask for hormones. I'm not sure, right? Donna has got the answer for you. So this is such important information, Donna. Okay, now I'm gonna be quiet. Start off by tell us how you got into the hormone area and a little bit about your story, okay?
Well, it's not pretty. It's not pretty. Actually, I was a hormone train wreck 30 years ago. So in my early 30s, I had a severe case of PMS. Now, you're a practitioner. You know what that abbreviation is for, right? Pretty mean sister. Okay. That was me. Once a month, I wanted to rip everybody's head off. I had heavy periods. I had acne. I was 30. I think puberty's done by 30, right? I had the hormonal headaches. I had all kinds of issues. And thank God, I realized it was hormones. Now, that was my early 30s. I just turned 60. I've been in this field a long, long time. So since those early days of PMS, I've also had stress hormone issues. I've been through perimenopause, menopause, thyroid. I'm postmenopausal. I know what all of that feels like. And my mission, I mean, you've been talking about it since you turned on your mic, is to help women and practitioners understand what's going on with hormones, what the options are, what the data says. And thank you for having me, because I just want to get the word out. And if you think your listeners might be interested, your viewers, there's a real quick 7-question hormone quiz to help everybody know if, am I crazy or is it just my hormones?
Oh man, that sounds amazing. Oh, that's hilarious. Pretty mean syndrome. I know I had that when I was younger. And I think this hormone quiz, that's great. What we'll do, guys, is we're going to put the link to that quiz in the description below. It's not there yet, but after this live, it's going to be in the description.
Okay.
Yes. Thank you so much. All right.
Well, it's so important because not everybody realizes what symptoms are actually connected to hormone issues. So that first symptom is sleep. Are you having trouble going to sleep or staying asleep? Do you wake up between 3 and 5 a.m. and can't go back to sleep? Well, quite often sleep problems are affected by hormone imbalances. So is fatigue, being tired all day or just between 3 and 5 in the afternoon when you should be on top of your game. You'd rather be on top of your desk taking a nap. So low energy can absolutely be correlated with hormone issues. Then what you just said, Sunny, is that brain fog, not being able to remember what you went to the pantry for. The brain has hormone receptors. It needs normal, optimal amounts of hormones. Then there's the symptoms that we know about. We know of if PMS is related to hormones. We know the menopausal hot flashes and vaginal dryness and low sex drive. We get that that's related to hormone issues. And one patient told me her sex drive drove off. There's a lot of things involved in sex drive, and hormones are just one. Then there's weight. Not being able to lose weight despite doing everything right, or not being, if somebody changes the margins as we get older on what we can eat, and we can't just cut back a little bit and lose weight. So if you're doing absolutely everything right and you haven't given up because you aren't getting results, every single hormone affects our metabolism. You want to know which hormones cause weight gain? I can tell you real quick: high estrogen, low estrogen, high progesterone, low progesterone. High testosterone is associated with weight gain. So is low testosterone. High DHEA, low DHEA, high cortisol, low cortisol, and thyroid issues. All of those. It's just too easy to gain weight and so hard to lose it, especially if your hormones aren't optimized. And that last question is wrinkles. Wrinkling faster. Oh, by the way, women typically gain 20 pounds going through menopause. Doesn't have to be that way. So let's go back to wrinkles. Did you know that there was a study that came out that found women with low estrogen look 7 years older than women with normal levels of estrogen? Okay, I don't mind this getting older. 60 is not so bad, but the looking older, I don't want to do that, not any faster than I have to. And so we need normal levels of hormones for collagen production and for our skin to be thick and plump and so forth. So it's just sad to me that some women and providers don't recognize some of these other symptoms really are related to hormones, or hormones that are not quite at optimal levels.
Right. Well, I love that you're talking about optimal, not too high, not too low, Goldilocks. We want it just right.
Yes.
So women suspect, many people suspect, oh, I've got a hormone issue. And then they'll go to their provider and go, could I have a hormone issue? As a family doctor, I was given limited training on testing these very specific hormone levels. And that's really essential to see where someone is. And now in functional medicine, we have some other ways to do that. And then comes this idea of bioidenticals. Can you help us clarify a little bit? What does bioidentical hormone mean?
Oh, I'm so glad you brought that up, Sunny, because there's so much confusion. There's HRT, which stands for hormone replacement therapy. Then there's BHRT, bioidentical hormone replacement therapy. Well, aren't all hormones the same? Oh, no. And data does prove that, by the way. But no, they're not the same. So what are these bioidentical hormones? Let's all get on the same page, because there is a lot of confusion. Well, it's not an official medical term, bioidentical, but it comes from the fact that biologically identical or bioidentical hormones have the same exact molecular structure as endogenously produced hormones that we made. Now that's important, molecular structure. So the shape of the molecule, in this case being a hormone, each hormone has its own unique shape. They're kind of like keys that fit into a lock. Now, remember, hormones are the most powerful signaling molecules in the body. We need them. So hormones are like keys. They fit perfectly into their lock. Well, the wrong key doesn't fit quite in the wrong lock, even if you force it. So these bioidentical hormones have the same exact molecular structure as our hormones. So estradiol, one of the primary estrogens, fits perfectly in the estradiol receptor, as does progesterone and testosterone and melatonin, or DHEA, for example. And when you are using or supplementing with a biologically identical hormone, they have the same exact effects as the hormones as if we had produced them. Your body cannot tell the difference if you rubbed on a hormone cream or put on an estrogen patch that's bioidentical or had a pellet or injection. As long as it's bioidentical, it's exactly the same, and your body cannot tell the difference. So they follow the same metabolic pathways, meaning testosterone gets converted to estrogen and, down this steroid pathway, which your providers will remember. So they follow the same pathways. They make the same beneficial metabolites without the side effects. So if you use a non-bioidentical hormone, it doesn't fit quite in that hormone receptor. It doesn't release properly. If you've ever forced the wrong key and might not be able to get it out quite right. And it's kind of the same.
Yeah,
So, using a non-bioidentical leads to adverse effects, aka side effects. Here's a real good comparison for people that say, oh, what's the difference? All the hormones are the same. Well, think about progesterone. Human progesterone, bioidentical progesterone, whether it's a cream or prometrium or whatever, helps support pregnancy, helps prevent miscarriage, helps support fetal brain development. But synthetic progestin is what's in the morning after pill or birth control pills. Those don't support pregnancy. Those don't facilitate, support fetal brain development. Synthetic progestins versus bioidentical progesterone, they're very different molecules and have very different effects. So think about it that way. Popular estrogen is horse estrogen, Premarin.
Right.
Not the same as human estrogen. So hope that's kind of a long-winded explanation of what bioidenticals are, but simply they have the same molecular structure as human hormones. That's it.
I think you explained that beautifully. I mean, much better than I could have explained it. And it mystifies me. Sometimes I'll hear someone who's in conventional medicine say BHRT, oh golly, that's not evidence supported, when really bioidentical is really just saying the same thing as you have in your body, and that is research supported. There is some politics around BHRT, and it's unfortunate when we start to politicize medicine, because we all need to help our body do things as naturally as possible. Right. And that's really what you're talking about, getting the optimal levels of the natural hormones that you would otherwise make when and finding that, striking the balance. I think that's what really understanding bioidenticals. And so we're not politicizing this. This is just for women, to help women understand what their options are. So when I was in medical school, also, it was right around the time when that Women's Health Initiative came out, and New York Times splashed on the front page, everybody stop your hormones, which is so unfortunate now, because I know we'll dive into this a little bit, but they've now reevaluated all that data, and we have a very different message. But most of the physicians who were trained during that time still think that they should not give women hormone replacement. So it's interesting. Do you want to speak? And as part of it, they're worried about cancer. All right. So let's talk a little bit about cancer and hormone replacement. Just a little bit about your perspective on that and the evidence.
Well, let's do. And I think a nice segue, Sunny, might be well, why is there so much confusion about, oh, there's no data, or is there data? Well, it kind of comes back, it comes back to the misuse of the nomenclature. So whenever a study comes out, in fact, one just came out last week, whenever a study comes out on the use of hormones, in the conclusion or the summary, it doesn't necessarily say which hormones. Was it a progestin, non-bioidentical progestin? Was it bioidentical progesterone? Was it estradiol? Was it horse urine estrogen? Was it ethinyl estradiol? And so in those conclusions, they're not defining. So there was a study that came out last week saying something about progesterone causes this and that. But when you go back and see, they use a synthetic progestin, not progesterone. So there's a lot of confusion. So what we have to do, as a provider, what you have to do, and the media should do a more responsible job, is say estradiol, which is the human estrogen, has been shown, or in this study was shown to do such and such. Progestin or medroxyprogesterone, whichever. Explain what the study, what hormone was used in the study to clear up things. So you mentioned this big study that came out way back in 2003. I was at a hormone conference. I know where it was when that was released that day.
A lot of women do, because they're like, oh, I have to stop my hormones.
Yes. Well, I was at a hormone conference. But what was that particular study, which caused a lot of physicians, everybody stopped using hormones. Women wanted off. Physicians, being responsible, were like, I got to get my patients off. So that study was done on equine horse estrogen and synthetic progesterone. And it caused some problems, some cancers, and increased risk of breast cancer.
Just to as an aside, that it showed a trend. It was not a statistically significant. And when
you are right.
And so we just don't want people to think that really showed it. That was what they said it showed. But that was not true, guys. So yeah.
You are so right. Thank you. Yes. And so then when they went back and, and remember what hormones it used. Horse estrogen and synthetic progesterone. Well, come to find out, even horse estrogen doesn't cause breast cancer. It actually prevents it. And so what you just brought up is the 19-year reanalysis. They reanalyzed this big study called the WHI, and what they really found is the only problem in there is a synthetic progesterone. It's been shown to cause breast cancer, but what they found is that the use of estrogen, in that case, horse estrogen, reduced the risk of breast cancer by, 23%, 20%? Yeah, 23%. So it didn't cause breast cancer, actually prevented it. Now, last year, a study came out in 2022. Now we have even more information. A study was done by Yale. Okay, you've heard of Yale.
Yeah, you guys have heard of Yale. That's
yes.
Right.
A 7 million women study followed them over 12 years, and they compared different types of hormones, different routes of administration, different strengths. And what they found that if women on estrogen had a 33% less risk of breast cancer, a lesser risk of breast cancer if they had been on it 5 years. But that, there's even more substantiation. There's been at least 31 other studies showing it, like this 19-year reanalysis of the WHI, which found a 23% reduced risk of getting breast cancer for the next 20 years of their life. That's even if they had only taken estrogen a short period of time. And then let's take this one step further. The women that had been on estrogen in the WHI, if they got breast cancer, they had a 44% less risk of dying from it. I mean,
wow,
I didn't make that up. That's in the studies. So I'm so sad for the women that have suffered and yanked off of hormones. Now, I'm not recommending horse estrogen because there's a better way. I'm not recommending oral estrogen, but it's the truth. So thank you so much for letting me share some of this data that is there, because we have to help people. So I support your mission.
Well, and I support your mission because, Donna has created the BHRT Training Academy, and that's where, if you're a provider, you can go and learn the new way to help balance hormones. And so this is essential training for primary care physicians. If you're taking care of women throughout the lifespan, that kind of thing is essential. And if you're like, oh, I don't believe that, I haven't heard that, you can read Donna's book that's coming up. I'm sure you're going to be talking about what the title of your book is, The Hormone Makeover, right?
Correct.
And it's going to be coming out this fall. We're so excited. Earlier release doesn't include all of this new information, I'm betting. And so now
it does. Actually, it does.
Oh,
it does.
Well, so she's got a book coming out, and that book, definitely want to look into that, and the book Estrogen Matters.
That is a wonderful book.
Estrogen Matters really lays it out how people got confused and providers got confused. Yes. So the link to both Donna's book and to Estrogen Matters, that's going to be in the description below. This is critical information. You when you go to your doctor and you say, I think I might have a hormone problem, you say, hey, and if they go, no, I don't give hormones. Well, they need to expand their information, and they need to look into these resources, guys, and they want to.
The data's there.
The data is
they
there.
Do want to, and thank you for saying that, because some providers really do want to take care of their patients, but like you weren't trained in bioidentical hormones in med school. And, women often expect, they're frustrated. Oh, my gynecologist won't test my hormones. Gynes are surgeons. It's not their fault. They weren't trained that. But so many have done what you've done, Sunny, and stepped out of the box of conventional medicine and sought out additional training, because you want to understand functional medicine and prevention and optimal, health, not just, lab ranges that are barely enough to keep somebody alive. So that is why, I started the whole, BHRT Provider Training Academy. It's an institution of higher learning. We are accredited and we give CMEs, and because they're just providers really, really do want to learn. They really do want to learn bioidentical hormones, which is so exciting to me.
Yeah. Oh, I love it. Well, it's critical service. We're trying to help women throughout the lifespan. And guys, if you go to your provider and you don't get help, I'm imagining that Donna probably has certified people all over the country from your program. Mm-hmm. Another resource is the Hormone Club. That's an online where you can chat with the doc. But so we just want to make sure that you get your hormones balanced. And then as a functional medicine doctor, I'd say, those things that Donna talked about, sleeping, managing weight, releasing weight, and all of these critical questions. Are you tired in the afternoon? Those things also contribute to whether or not you're going to live long and well. Okay.
Oh, yes.
Right. So we really want to dial in these things. Functional medicine, we do a lot of nutrition, stress management, get you sleeping. And once you dial these things in, it's more likely, y'all, you're going to have a good long life. And my hormones, I'm not letting go of my hormones, Donna. Never.
I agree. Yes, thank you. And we think about using hormones for the symptoms. I brought up symptoms, but what you said is the other half of that picture. Hormones aren't just to, getting them into balance doesn't just help symptoms, because it does. But it's also about preventing and protecting against the conditions and diseases associated with aging. Hormones are about way more than reproductions. And when I say reproduction, when I say hormones, I'm talking about thyroid, insulin, adrenal hormones, and these sex or reproductive hormones. So we need optimal levels of these to prevent cancer. Again, progesterone is very cancer protective and preventive, so is testosterone in women, but also to help protect against the loss of cognitive decline. We want to remember who our kids are when we're, so they protect the brain, the heart, bones, skin, joints, vision. I mean, there are hormone receptors in every cell of our entire body, and they're anti-inflammatory. So we need optimal levels to live well and long, just like you said.
very true. You know, I work with people who have memory issues with the Recode protocol. And if you guys haven't read The End of Alzheimer's, it's an incredible book, everybody. But The End of Alzheimer's, within that, Dale Bredesen talks about how there are switches that turn on and off the production of this amyloid protein that you don't want to build up in your brain that is correlated with Alzheimer's and the development of poor memory. And the hormones are one of those switches that we want to have balanced, because when the hormones are balanced, it's more likely that you're going to have that switch turned off, so it's not making more amyloid beta protein. And that is just, it's important for so many things, because all your cells have receptors for hormones, guys. This has been an incredible discussion. I'm just honored, and I want to talk with you again in the future. Any last things? How can people find you, Donna? If I didn't say it enough, tell them again.
I'm Donna White. Our website is BHRT Training Academy.com. We're on all the social sites, BHRT Training Academy. As you mentioned, my book, The Hormone Makeover, really is a guide for women. It'll be out this fall. It's a guide for women that answers the most common questions about hormones and how to work with your provider, how to test your hormones, and some of the things that we've talked about today. So those sites are being set up now. So watch for the Hormone Makeover, the social channels and website. They're coming soon.
Beautiful. Well, I'm grateful for your time, your expertise, your great way of explaining things so they're easy to understand. And guys, reach out to Donna, or you can reach out to me, clinic at feelgoodfunctionalmed.com. That's my email. And I'm going to stop our live stream and say goodbye to everybody. And we will get Donna back on here sometime. Okay. Thanks, Donna.
Thank you, Sunny. Thank you so much.